Hi, Supernaturals is me again, your host, Beverly Hines. This is the Supernaturals podcast. And of course, I am the founder and CEO of Hair Scripts, the platform that is connecting multi-ethnic women with hair loss issues to dermatologists, trichologists, and other hair restoration specialists for treatment and support. So right now in front of you, you have Dr. Elvira Wright. She is a doctor of pharmacy, certified trichologist of World Trichology Society, and she is a fellow that is certified by the American Academy of Anti-Aging and Regenerative Medicine. She is also the owner of Wright Aesthetics Non-Invasive Hair Restoration. Non-invasive, did you hear that? So I'm really excited about having her here today. Before we jump into our topic today, which is about how to reactivate those sleepy follicles in your head that you thought were dead, but they're just sleeping, I want her to introduce herself, tell us about her years of experience, and how did you get here to this point. Dr. Elvira Wright, take the floor.
Hi, everybody. Thank you for having me. I'm a pharmacist by the trade, and I've been in so-called sickness industry by my definition for 30 years. And I knew that our body has amazing mechanism to restore and rejuvenate yourself, just given the right modalities for rejuvenation and restoration, proper building material, and remove the detoxification. So that's one of the reasons I went through the certification and fellowship in anti-aging and regenerative medicine, American Academy. I've got my fellowship behind, and I've got board certification. And I was looking for how can I implement as a pharmacist this type of knowledge. Shortly, I've got my esthetician license and peptide therapy certification through AFOM, American Academy of Anti-Aging, where we discuss 90 days protocol, hair restoration protocol. Since I don't know much about hair, I decided to get another certification as a trichologist to understand how exactly we can do it, how we can rejuvenate and restore these follicles. And that's everything. It was come together. I left my pharmacy world, my hospital pharmacy world for good. And I opened my medical spa where we practice non-invasive, natural and non-surgical hair restoration for hair and for whole body as well.
Wow. So you're a woman after my own heart. I love someone who wants to educate themselves and learn as much as they can about a topic so that they can be a subject matter expert. So let's dive into this topic because we always talk about scarring alopecia, non-scarring alopecia here. Sometimes we've had trichologists or even dermatologists who say, well, maybe it's not scarred. There are some tactics that you can do to kind of rejuvenate those follicles. So we've never had anyone dive in detail. So here you are. So let's talk about, first of all, what is a sleepy hair follicle?
Well, if you remember the proper morphology of the hair shaft itself, we have dermapapilla where we have a germinated matrix where you can start to proliferate the hair shaft in its own. And close to sebaceous gland, you have another stem cells. So we have two areas where we can activate all the stem cells that will be proliferated into the beautiful hair follicles. And even completely bald area, specifically in genetic type of alopecia, we still have a lot of stem cells sitting under the scalp waiting to be awakening through the different modalities. And that's what I try to use. I try to awaken the bearer, I would say. In this case, we will be able to stimulate through different type of approach all these stem cells that has been sitting there waiting to be awakening and proliferate in the hair shafts.
I love the science behind this stuff, right? Me personally, I love the science because I'm like, oh my God, that's so interesting. There's stem cells that sit underneath the follicle that you can reactivate to then reactivate the follicle. But I like to kind of break things down a little more simplistic for my audience. So let's go back to defining completely bald. How do you define a completely bald area?
Usually it's mostly on males. When you see the Hamilton type of scales, it's around probably like you have a little small fringe and maybe a little bit here on the frontal area, and the rest is bald. You even don't see hair follicles openings, and that I will define bald.
Gotcha. So
I
how
will
does
define.
that look to the naked eye?
It looks. It's shiny,
Mhm.
like a desert island, I would say, with no trees and no bushes.
Right. So you're
Um,
saying that you can reactivate the stem cells underneath that shininess. There's still a possibility.
Yes, I do have actually a couple clients who came with this kind of condition, and we're working extensively. Since it's a multifactorial approaches, maybe one protocol with my 90 days, that usually work for majority of my clients, will not be sufficient for them. We go for the second modality. We use different type of approaches beside the peptides. We use PRP, exosomes, growth factors. So we try to see which one will be most appropriate, or maybe we finish one and we move to another one and move to the third one to stimulate the follicle proliferation from different aspects using different growth factors, different type of modalities.
So talk to my audience, because a lot of people always want to try something DIY, right? Is there anything at home or DIY that they can do to start stimulating those stem cells?
The simplest one, is derma roller. When you do derma roller on your scalp, you create small channels, very small control wound channels that will actually stimulate your own stem cells, started to bring all these growth factors, growth factors, and like 4 or 5 different factors that growth factors stays in this area that you will be stimulated and bringing for the regenerative processes of this little small wound. So it's recommended once a week.
Once a week?
Once a week minimum. And some people put additional application like minoxidil. I'm not in favor of minoxidil, but this is the one of them. Sometimes you can find a specific formulation related to the hair. I was reading a lot of literature. There is some combination of herbal remedies, liposomal type of hair remedies you can apply after derma rolling. That's probably will be the most easiest approach to stimulate your own stem cells production.
I have so many questions. That's awesome. Listen, ladies, if you guys missed that, what she's saying is, if you have gone bald, if you were told that you were gone bald, right? You've gone bald. There are stem cells underneath your follicle. Even if you're presenting with that shininess, and if you're not presenting with that shininess, is even better, right? There are stem cells underneath those follicles that you can reactivate. And there's a lot of different strategies for doing that, right? And of course, the number one thing I recommend everyone do is go see a specialist, go see either a trichologist or a dermatologist. But for DIY, the number one thing you can do, she mentioned, was using a derma roller, because it's going to create small wound channels that's going to stimulate those stem cells underneath your scalp or underneath the follicles.
Correct.
So first question for you, Dr. Wright, is where can we find a derma roller that is effective at home? Because there's so many on the market. You can buy one on Amazon, but what's a really effective derma roller that you can recommend we buy?
Mostly the derma rollers you can buy from Amazon or other real estate sources. It's probably not enough length. It should be between 0.5 to 1 millimeters to have a very stimulating effect. Probably for the healthcare practitioners, that's maybe the best way, who specializing on this. Dermatologist maybe ordered for you. Because I was running out of derma rollers and my supplying company was run out. I tried to order from Amazon and all I've got 0.2, 0.3 millimeters. And that's not enough to stimulate. It's good. It's okay for the facial, but for the scalp, especially if you have sometimes inflammation, a little bit scar tissue goes under, that might not be sufficient. You have to be
so awesome.
Have to be a little bit longer, the needles.
You are giving us so much good information. I'm really excited about the things that you're talking about, because you're giving us really great tactics that no one else really discusses on this show. So for those of you, 0.5 to 1 milliliter is what you need.
Millimeter.
millimeter is what you need,
Millimeter.
because what you'll find on Amazon, etc., is not deep enough. It's okay for the skin, but for the scalp, you need it to penetrate deeper, especially if you're dealing with some inflammation. The second thing you said was people like to kind of mix this or add adjunct therapy with some type of topical serum or treatment, right? Now,
Correct.
you said people usually use minoxidil. You don't like minoxidil. Why it's not your favorite topical treatment?
Minoxidil has some side effects, including some itchings and flakiness. It's not only, it's only good for the first couple of years, and then it's a receptor is going to be saturated. We call in pharmacy tachyphylaxis, meaning your receptors become saturated with this type of molecules and not responded very well. So that's no effect after a couple of years. Usually, you don't see
resistance.
It's kind of like a resistance, like if you're talking about the opioid drug addicts, they constantly started to increase the dose. That's the same effect. Your receptors have already enough. In order to be activated, you have to have more to have the same effect when you had in the beginning.
So now you said you prefer certain herbal remedies. So can you define, or can you be specific about which herbal remedies you prefer to use in conjunction with the derma roller?
Well, we have, for my clients, we use peptide therapy. They will use, peptide therapy. Specifically, it's PTT-DBM. That's a long name for peptides, has been specifically developed for these purposes. And in conjunction with valproic acid, which is medication, but this is usually it's taken for injection as injectable form or a tablets form for seizures. However, the study has been done on mouses, and this specific formulation was applied to shaved mouses, and they proliferate hair very rapidly. In conjunction with PTT-DBM and valproic acids, they go together spray after spray. After derma roller, they affect one of the pathway called WNTTB catenin that helps to accelerate dermopapillar and prevent not just the choking of the hair or miniaturization hair, but through the blocking one of the other peptides, but also help to accelerate dermopapilla in anagen phase and help to expand anagen phase or stimulate the new hair growth. So
again, me breaking this down for my audience, okay? So she recommends the herbal remedies that Dr. Wright recommends are peptide therapy, specifically PPDBM, correct? Which overall what it does is it pretty much accelerates the anagen growth phase, right? In layman's terms.
Yes.
In layman's
and prevent hair miniaturization. That's one of the main problem for genetic type of alopecia.
So my question for you is this peptide therapy only accessible through an expert like yourself, through a trichologist or dermatologist, or is it something that we can purchase online or we can create ourselves?
It's a tricky question. Unfortunately, it's a prescription type of medication, has to be done through the professionals. However, talking about maybe other accessible type of form, herbal therapy is going to be some oil therapy, aromatherapy, rosemary, argan oil. They all have been shown stimulating the hair growth. You can find, I believe it's a Crisan, one of the companies, Crisan, they have a 50 different organic oils has been combined together, all helping with promoting hair growth. You might try using this type of aromatherapy after derma rollers.
Okay, and you said that Crisan is the name of the company with 50 essential oils.
Yeah, blend together.
Blend it together, and that's an over-the-counter alternative.
It's over-the-counter, exactly. Yes.
Over-the-counter alternative. So, instead of them getting the prescription medication, which is the PPDBM. Now, what's the effectiveness, right? What's the difference? Not that there's any head-to-head studies between the PPDBM and, let's say the oils, the essential oils, but how effective, if someone doesn't get a prescription or don't have access to a prescription, how effective are the essential oils?
It's very per each person, depending on what kind of hair loss they have.
Right.
Of course, if it's a cicatricial type of alopecia, scarring type of alopecia, it's more difficult because immune system is involved, and we have to address that as the cause of hair loss in the first place before we move to the cosmetic applications. Um, I cannot compare, honestly.
That's okay, because there's no comparison, right? So you can't.
No,
If there's clinical
I
data,
can't. It's never has been done by me personally or anybody else. That's the reason I cannot answer the question.
no worries, no worries. How effective is the peptide therapy? Are there any success rates that you could that you can say, or based on clinical data or your own clinical experience? What are the success rates?
We have a 90 days protocol where you can start to see hair grow in 30 days to 6 weeks. But we implement, it's not just a peptide therapy, because this is multifactorial approach. We also
Right.
put people on nutraceutical support. We use specific grooming kits with shampoos and conditioner that specifically address the issues that client has. If it's a itchiness, burning type of scalp issues, or it's just a regular scalp, we have a different shampoos. We also I do the PRP, platelet-rich plasma procedure, prior to putting people on home protocol with the peptides or exosomes or growth factors. So it depends. And in 6 weeks, between 30 days to 6 weeks, we started to see the results.
So, and again, I love to kind of reiterate everything that you say for the audience to break it down for them. So the beauty is what she's saying is a multifactorial approach to treating hair loss, meaning there's no one size fit all, right? Everyone's hair loss is different. And you can't just try one therapy. You have to apply multiple different therapies based on what that person's hair loss is. That is why my number one recommendation to everyone listening to this today is please schedule an appointment with an expert, okay? You can't do this by yourself, okay? Not only can you not do this by yourself, but you can't diagnose what type of hair loss you have. So if you're looking for a specialist, you can find one at hairscriptsapp.com, but also Dr. Wright will tell you where you can find her if you're in her area, if you really want to rejuvenate those sleepy follicles, right? So now let's talk about some alternatives for people who either don't have the money or don't have the insurance, right? So you said there's a 90-day protocol. You said you like to include nutraceuticals. Are there any over-the-counter nutraceuticals that you can recommend that you think are effective?
We use two. We use a Nutrafol that has, it's first of all, it's address your hormonal imbalances. It address your adrenal, which is also super important because stress can induce the hair loss.
Right.
And all nutraceutical, supplementation with the vitamins that absolutely important for support your hair health. And another one is Norcrene. It's come from England. It has 30 years of study and study, maybe not 30 years, but 30 years of a positive feedback and a few years of clinical studies behind.
Can you repeat the name of that one?
Norcrene, it's Nourkin, Norcrene.
Okay, Norcrene. Okay, so here we talk a lot about Nutrafol because my dermatologist recommended Nutrafol to me. So I've been on Nutrafol for a long time. I love it. And so I always talk about Nutrafol. So I'm so glad you brought that one up because you're confirming that Nutrafol has clinical data to support what it does. Now, you said grooming kits that you also recommend, shampoo and conditioners, and there's no one size fit all depending on the scalp condition. However, just if you can name one grooming kit over the counter that you recommend, what would that be?
We use Psoria's type of shampoos. It's a combination of shampoos and conditioner. Psoria company, and this is for the itchy scalp. Any kind of seborrheic dermatitis, any kind of problem that's related to itchiness. Even some people who has autoimmune diseases, they found this because they have a very sensitive scalp. This type
Right.
of all natural, no any kind of chemicals added. And another ones we use through the company who provide us with protocol. It's a P2 company. Unfortunately, that's difficult to get over the counter.
Over the counter.
Yeah,
Okay.
but a lot of them of the company, it's a French company. It's like FUR and further. I try to remember this day. Yeah,
Don't worry. If you remember, send me an email and I'll link it for the viewers.
They have really good trio. You can use shampoo, conditioner, and a serum. I've got some samples, but since we already have a good supply and good results with the shampoos and conditioner we already have in the client, I didn't use it, but I found it's very useful as well.
I think that's very important to know because people don't realize the importance of shampoos and conditioners. They'll run to Walmart and Target and just pick up whatever is on sale. And we kind of feel like, oh, it's not going to sit on your scalp for a long time. So it's not really that important. So it's very good that you're really isolating the importance of shampoo and conditioner.
We have to remember we're really living in a toxic world, and it's come from everywhere. Toxin bombarded us through food, for air, for water, for whatever grooming kits we use, for skincare product. So that's very important to look in the back of the label and see if you have lauryl sulfate, if you have some propylene glycol, if you have some kind of toxins you cannot, or some chemicals you cannot pronunciate, put it back.
That's the rule. If there's a chemical that you can't pronounce, just put it back, okay?
Yeah.
So you mentioned PRP, and we're very familiar with PRP here on this channel, and a lot of prescribers, a lot of experts have discussed PRP here. So I want to move over really quickly to exosomes, you said, and growth factors. Exactly what is that? And then is there some type of way that we can capture that, get that over the counter or something similar?
I don't think you can get this over the counter, unfortunately, because it's a prerogative of healthcare practitioner decided what kind of concentration you have to use it, how many procedures it has to be done. It's for topical application. It's not effective. It has to be injected or microneedled. So it has to be done in a professional office. So exosomes, it's a precursor of stem cells. It's even a pre-stem cells. It goes and work as a kind of like a signal molecules. It comes and tell what needs to be done. If you inject in the scalp area, it goes to say, hey, I'm here, let's start to produce your hair. Or if it's injected in the area, like intravenous injections, it goes through whole your body as an IV infusion and start to repair whatever needs to be repaired by stimulating the always growing factors and stem cells proliferation in a proper type of tissues. Growth factors itself, it's identical to human growth factors, but produced by bacteria. And this product comes from Australia. And we have two different kind, one for the facial application, again, through the microneedling, and second for the hair.
Gotcha. So these are topical.
They are microneedling type of
microneedling as well. So my question for someone who's looking for something over the counter, I know it's nowhere near the same, but would a probiotic work in some way?
We have to remember about the probiotics. What's the main purpose for that? It's for the facial application is going to be probably just to maintain pH of the skin and scalp properly by overcoming the propionic bacteria, or if you have some Neisseria or any type of bacteria, harmful bacteria on the scalp that induce folliculitis, for example, or something like this. So it's mostly for the adjustment of pH of the skin rather than to stimulating your own production of whatever it needs to be, collagen and elastin on the facial or hair on your scalp. So microneedling in that sense is better.
Microneedling is better.
Derma roller, yes.
And do you usually do that in combination with PRP?
Yes, patients will go home with 90 days protocol where they have all peptides coming with them, some of them topical, some even injectable. And they also use Dermarol twice a week or sometimes once a week with the peptides applied after dermaroller.
And you said you've seen success. Now define success, because success is defined differently depending on how you measure that. So what's success? Is it some growth? Is it fullness? What is success?
We do the proscope pictures before and after. You definitely can see thickness of the hair shaft. You see density increased. This is only 50 times magnification, for example. From the, nobody goes and look at your scalp, right, when they see you. But I have clients who was wearing hairpiece. They don't wear a hairpiece anymore.
Wow, Dr. Wright, that is very impressive. So anything else that you want to tell us about Wright Aesthetics?
Well, Wright Aesthetics, we treat patients as a holistic person, not just the hair, not just the body. I mean, the area below your head, or just the face. We introduce epigenetic hair test where we pluck for hair, and in 15 minutes we can tell you which minerals, vitamins you're missing, which amino acids you're missing, if you have mold toxicity, if you have heavy metal toxicity, if you are sensitive to radiation, if you're sensitive to EMLF from phone, from TV. But the best part, at the end, you have 90 days plan what you should to eat in order to overcome all these deficiencies or fight the infection, fight your parasites or mold if we determine you have it. If you have heavy metal, how to eliminate that using food. So we have to go back to original principles, back what Avicenna was talking about, let your food to be a medicine. We try to go back to centuries where our predecessor treated people more holistically. So after we determine what you're missing in your body, whatever you want to lose weight, or you want to adjust your hormones, if you want to do some facials, if you want to do your hair, we address inside imbalances, and then we proceed to your cosmetic rejuvenation, restoration, and build your confidence from inside out and outside in.
That is awesome. I want to be a patient. I want to come and check you out. And I want you to start. I was diagnosed with female pattern hair loss, by the way. Hence why I started the community and the platform, because I thought that I couldn't be the only one going through this. I had a head full of hair my whole life, never had to worry about anything, never took care of it. And then, I started going through the symptoms, et cetera. And a dermatologist did a biopsy, and we it was hair loss. It was female hair loss, androgenic alopecia. So Dr. Wright, where can we find you if we're interested in working with you? And do you accept insurance?
Insurance, it's a painful question. Unfortunately, insurance don't pay for the cosmetic procedures, and this is all considers to be cosmetic. We do accept if you have the prepaid prior to taxes, the fund, that you can use it toward to restoration procedures or toward to prescription peptides. It's accept through our system. You can find us in Clearwater, which is Florida. What interesting, I believe you can do, before the COVID area, people was flying to do some cosmetic procedures overseas. You can fly now to Florida. We fully open, and you can write off your taxes. We can see you on Saturdays. Do your procedures on Saturdays, and you can fly back on Sunday.
Listen, guys, Dr. Wright.
I want to say thank you so much for doing this absolutely wonderful work, because for guys, they can go bald, they can shave and still will be sexy, looking sexy. For females, it's a huge challenge. The most challenge for me is going to be cicatricial type of alopecias, scarring alopecia. It's very difficult to treat, and unfortunately, it's not always a success. But we try to stop progression, and we try to treat people inside with working with the immune system to calm it down. And in this case, we save what person already has. So thank you so much from bottom of my heart what you're doing. I really appreciate that.
Dr. Wright, thank you so much for that. I really appreciate the affirmation and the validation, because you need to know that what you're doing is actually helping and will help a lot of women in this case. Like you said, men can go bald and be sexy, but for us, it does take, and we can be beautiful, but it takes a lot out of us psychologically, right? And so I thank you. This was one of my favorite interviews. I have to be honest with you. I love the science because I really love data that supports the stuff that we're doing, because I want to know that there's data that says that this actually works. So everyone who's listening, if you're in the Clearwater area and you have some money to spare, you just got your tax return, honey, and you want that hair back on your head, go visit Dr. Wright, because she has the science. She has dedicated, obviously you can tell she has dedicated a lot of time and research to making sure that she has the right custom plan for you. And that's why you need to see a specialist, because a specialist is not going to just give you a generic product over the counter. They're going to identify the problems that are going on with you internally and externally, and then create a growth plan that is custom to you, that is going to be effective. Dr. Wright, if there's anything else you want to say to our audience, please say it now.
It's always a hope. Never lose a hope. That's my message.
Thank you so much. Thank you for joining the Supernaturals podcast. And thank you so much for what you said about hair scripts. Have a great weekend.